Hi there, my name is Tim Mulholland. I'm a podiatrist at Pride Plus Health and clinical academic at La Trobe University. I'd like to talk to you today around diabetes and feet and why it's imperative if you have diabetes that you have a strong relationship with your podiatrist. And that's just not me, a biased podiatrist saying that. That's something that comes recommended by Diabetes Australia. So, diabetes, feet. What are the connections? So if you're watching this, I'm expecting that you have an idea about what diabetes is. Maybe you have been diagnosed with diabetes or you're caring for a loved one who has diabetes. It's important to understand that there are various types of diabetes and this advice is pretty general in nature. We're not going to talk about the type 1 versus type 2, well-controlled, poorly controlled, and different types of insulin sensitivities. We're going to leave that for other videos and other academics to discuss. What we're going to talk about today is the way that your feet can be the canaries in the coal mine, and they can tell you some things that are going on relating to your overall health and changes relating to diabetes just from what's going down at your feet. There's also some serious complications that can happen with diabetes and feet. And so not only can they be just the canaries saying, hold on, some things are going on here, they can also have a few problems that can compromise the way we like to live our lives and can even be one of those contributing factors towards mortality. Quite serious things, but the important thing to know is most of this is preventable with some good home practices. So, the two areas that are really key for us to all understand and appreciate with diabetes in our feet is the circulation system and the sensation system. So, we're going to talk about the circulation first. An analogy we're going to use is some plumbing. And then we're going to talk about sensation, and we're going to be looking more at electrical wiring for those. So when we think of circulation, we've got a big strong heart that pumps blood all the way around our body. Now, as the blood leaves our heart, it comes out in a single artery, splits it around the navel, the belly button there, into an artery for the left and the right side, and that blood with all of the good nutrients travels down our legs. Below the knee, we end up having it bifurcate or trifurcate and spread out into 3 arteries, and then all of that blood rushes down towards the tips of the toes. Now with diabetes, and also some other conditions, things that can happen as a result of bad luck or smoking or excess alcohol intake, is you can have some circulation changes. So those artery walls can harden, so instead of them pulsating like your heart beats and allows that nice efficient movement of blood all the way down to your feet, they can become a little bit more like drain pipes and blood flows through but not quite as elastically. And we can also get some plaques or some blockages that can build up inside those arteries as well. They often happen in combination. You start to get some hard artery walls, then you start getting some plaques that build up and some blockages that stick to those walls because they're not moving as much. If that happens and you get enough arteries blocked or the blockage is happening at a level where there is only one big main artery, then we can lose that blood flowing down there. No blood means no nutrients. So we're not able to turn over and build new hair, new skin, new nails. And so as we start to go on our lives, we start to get some tissue death. The skin becomes drier and thinner, it becomes more cracked, and any sort of little lesions that might have been very protective, like a callus, can end up ulcerate underneath if we start getting to the severe side of things. So how you can test your circulation at home and get a little bit of a picture, and then how we podiatrists can find an even more information out about your feet, is by looking at a few things. You're going to be looking for the pulses in your feet. So in the same way you've got a strong neck pulse and wrist pulse, you should have 2 strong pulses, dorsalis pedis and posterior tibial in the feet. You're also going to be looking at some clinical signs and symptoms. So is the skin colour in your feet what it has always been, or has it started to change? If you squeeze the tips of your toes, do you start to see some blanching? Does the skin go pale and does then it come back to your normal colour in under 5 seconds? Do your toenails, does the hair on the tops of your feet, if you have some, still grow as it used to? If they're in place, then they're good signs that the circulation is going okay. But we want to be more specific than that. So one of the most advanced ways that we can very quickly find out what your circulation is like is in clinic we do something called an absolute toe pressure. So very similar to when you would have your blood pressure taken from your doctor or your nurse at the arm and you're looking for a reading, we'll take the blood pressure of your big toe. It's about as far away from the heart as you can get. If we get readings above 80, getting close to the 110, 120 mark, then we've got a great sign that your circulation is brilliant at getting all the way to the tip of the toe. If it's below 80 and above 30, then we've got some reduced circulation. It's not yet at the time where things are going to fall off and stop and serious problems, but it's a sign that things have reduced. If it's below 30, that's where the warning bells are going off. We don't have enough blood flowing down there for healing. So if you were to get a cut, that's not going to heal up. That's where the ulceration amputation pathway is. That's where your podiatrist and you would be flagging this and working with a vascular team to try and revascularize and get more blood flowing down to the tips of your toes. So these numbers, they will vary a little bit, and two people can have excellent circulation in slightly different numbers. We could have Jenny with a toe pressure of 110 and Tony with a toe pressure of 85. But if those tests, if Jenny is consistently getting 110 year on year and Tony is consistently getting 85, they're great results for both of them. We shouldn't be comparing between each other. If Tony's toe pressure is staying at 85 every year, but Jenny's is decreasing, so she goes from that 110 to 100 to 85 to 60, then we can see a trend where we've got some circulation changes. That canary is letting us know that Jenny's got a blockage, some hardening of those vessels, and we need to do a little bit more. We need to involve a medical team to try and find out what and why that is happening. So there's the circulation side of things. If we've got enough of the good stuff getting down there, things are going to heal up. And even if we do have accidents, we're going to be okay. Other side, the wiring, the electrical side of things, the sensation or nervous system. So with diabetes, something that can happen is you can have your nerves be damaged. Now, damaged nerves can lead to a couple of tricky things. You might lose the gift of pain. So pain is obviously something that is very unpleasant, but it is the signal for our body to go, shivers, something is happening down there. I better look into it. When you touch a hot stove, you'll lift your hand off because it's hot and you don't want it to burn. When you've got a stone running around inside your shoe and it's pressing underneath your foot, ouch, you will take your shoe off and I'll take that stone out, so it's not going to give me any problems. So with diabetes, it can affect those nerves that send those pain signals up to the brain, and so you can lose that protective sensation. So if you don't know there's a stone inside the shoe, something rubbing, developing a blister, then you won't know to check. If you were to combine that with the poor circulation, so you have no sensation and you have poor circulation that it can't heal, that simple stone inside a shoe can cause an open wound, which is then going to ulcerate and not heal on the poor circulation side of things. That's the awful pathway around amputation, which is very much preventable for most of us if we get onto it in the early days. Serious stuff, but definitely important for us to consider. The nerves don't just tell us upstairs what's going on downstairs, but they also send some signals back the other way. So we have these motor nerves that end up telling us to move our feet, push on the ground. We also have some nerves that send back some signals that tell us where our feet are in space. Like the way when we walk upstairs, we don't have to look down at every single step to know that we are stepping up over the step. We inherently know because of our proprioception that, we've lifted our foot up enough and I've put it down there. With diabetes, if we start to lose these motor nerves and some of that proprioception, we're going to be more prone to falling over, and we're not going to be able to adapt to uneven surfaces, like when we step on a bit of a pavement that's got a crack in it, or if we stand on something a little bit slippery. We're not going to be able to adjust and more likely to fall and come ungutsa. Certainly things we want to avoid. So, if we think about what we can do to check our sensation at home, there is something called the Ipswich touch test, which is a no-equipment test that somebody can perform on you, and you can find out if you've got that protective sensation. If you have a look at the link that will pop below the video or on our website, we'll explain how to do the Ipswich touch test, and you can learn a little bit more about that. As for what your podiatrist will be doing, your podiatrist will be using a combination of tuning forks, monofilaments, the Ipswich touch test, and a few other things in clinic to find out if we've got protective sensation, do we have these signals travelling up and down, and if there are some changes, how we manage around those changes. There could be certain shoes that are recommended to wear, certain orthotics to deflect pressure from peak areas, or even just some behaviour changes. It might mean that every evening as you're going to bed and every morning before you pop your shoes on, that you need to be a bit more cautious, checking inside your shoes and having a look at the bottom of your feet. If you're unable to look, you can use things like a mirror or even take a photo on your phone, have a bit of a look at it. I know many clients that have got hundreds of photos of their feet on their phone. Quite a disturbing gallery. You want to make sure that you're not backing that up to the cloud. All right. I hope that that's been informative, learning about diabetes and feet and what us podiatrists can do to help you manage your feet. If we're thinking about those recommendations again, so Diabetes Australia recommends that everybody who does have diabetes sees a podiatrist at least once a year, and that's if you're at low risk of complications. If you're at moderate or higher risk, then those visits become important to have more often, and you'll likely have a much closer relationship with your podiatrist as you go through that. We'll record a couple of other videos talking about how to best look after your feet when you have low risk, moderate risk, or high risk complications. If you'd like to learn a little bit about those as well, head to the website, prideplus.com.au.